Dr. Annie that's going to talk to us about what she's been doing in terms of really taking forward this brilliant initiative. Dr. Annie, sincere thanks for your continued support, your engagement. I'm really excited now to hear about you from a nursing and policy perspective, which is so important in terms of influencing what nurses do and how they operate.
Thank you. Anthony, can I just take up?
Hi there, Dr. Annie. Yes, I'll stop sharing.
Hi, good morning and good afternoon to one and all, to all the participants over here. First of all, I thank the organizers of Nursing Now, giving us an opportunity to highlight and give a visibility what are the challenges we as nurses face in the leadership in India. So that is the real great thing that, especially for India, you have organized. I really thank all the organizers who are working behind the screen for quite a long time for this thing. So let me share my screen. I'm going to give my views, how Indian scenario, which is not really, nurses are not much involved in the policy making board, or their voices are not heard. So one thing, whenever we think of policy making, we need to have three pillars to represent to the policy making level. We need to be very much strengthened in three pillars. One is education, the second one is regulation, the third one is associations. The others are miscellaneous factors, we can say. The first one, when it comes to education, if you see time immemorial, there are two separate things. One is medical education and nursing education. When we talk about medical education, always this country has given so much importance to the quality of medical education. When it comes to nursing education, instead of strengthening, rather it has gone into the deviated path, producing highly skilled nurses. There has been always, whenever there's a dearth of nurses occur, they started producing semi-skilled nursing laborers, like nursing aides, nursing assistants, attenders, or they call them as a general duty assistant. They all with overlapping role with nurses, so that, and also during this time, there's a privatization and corporatization happened in India on the run. So that time, what happened, the nurses who really looked for a good avenue and a good recognition, they migrated to other countries. So because of that, there is a dearth of nurses happening in this country. So this led to poor quality of nursing care, and also there is no people with a higher qualification, with a higher position to hold the higher positions in the sectors, in the private sector as well as the government sector, or otherwise it is mostly occupied by the doctors, the higher level posts, or non-nursing professionals are holding the highest post in the sectors. And here, when we talk about a medical education when we studied in 1980s, I still think we are all graduated from college, the common university, where they were having arts and medicine, everything. But in late 90s, there's a separate medical university started coming into the scene of in the country. And later 2000, it started coming as a health university. But however, there is no representation as given in these universities for either as academic officer or controller of examination or registrar, nothing. Maybe one or two university in the health universities, maybe they might have given, but I could definitely say majority of the universities does not have a representation for nursing education to say what is our issues and challenges, what we are facing in nursing education. Now we need to reform this education, that need to be addressed over there. That is one of the first pillar I would like to address. The second pillar, when it comes to regulation, I can divide this one into three aspects. One is the Indian Nursing Council that represents the national body. The second one is the State Nursing Council, and the third one is state government directorates. When it take the National Council, Indian Nursing Council, they have really worked hard. They brought up a lot of courses, platter of courses, which gives you a specialization for so many areas like neonatal nursing, onco nursing, nurse practitioner course, and all that. But At the same time, we have not given a role clarity in each and every area. Even today, whatever I have been studied up to PhD, my license is only a registered nurse and a registered midwife. And the other license, which from time immemorial, from 1926, this country had the first licensure status for nurses. We have only A&M license or lady health visitor license and registered nurse and registered midwife. As the country evolved, the State Nursing Council really failed to address, based upon the Indian Nursing Council syllabuses, we could have established at least a clinical nurse specialist license or advanced nurse practitioner license or nurse practitioner licenses. That would have been given a clear-cut idea for the nurses to go further to occupy the higher level of positions. So that is the national level thing. And when it comes to state council, almost we have 28 state nursing councils in India. But except few council, most of the council's president, that the chairman of the council is only a doctor. That is either he is a director of medical services or the director of medical education. So where is the representation for nurses to go and represent at the policy making level with the government? And there is not a big representation. A doctor only represents for a nurse. Definitely he cannot be a real voice of a nurses when he goes and represents for a nurses in such a big country. We have a lot of issues in this country. So the third thing is state government. In the state government, we have a 3 directorates, that is Directorate of Public Health, Directorate of Medical Education, Directorate of Health Services. In all these 3 directorates, almost some of the states, the posts are vacant or posts are not created. Like our state, if you take, there is a DD nursing, JD nursing is there, but it has been all occupied by the non-nursing professional, or some of the posts are vacant. So in the southern part of the country, with so much of educational institution and things like that, I can imagine the northern part of the country, because of the skewed distribution of the nursing institution and other sector. Of course, there are exemptions are there, like in the West Bengal, there is a directorate of nursing where all the 3 sectors of nursing, public health nurse and nursing educators and the nursing service people have been grouped under nursing there. So this is the time we have to advocate for ourselves to establish in each and every state, there should be a state nursing directorate, so that our voice could be really being heard at the policy making level to represent ourselves, our views, our challenges, our better outcomes, what we are facing. So much of research studies being done by the nurse educators, but when it comes to implementation, it is not really coming to a real execution at all. Maybe 1 or 2 institutions, I can say exemption, but we have to take in this big country, we have to take the big sample only. So in that way, really, we are not really doing great things. And if you take the public health sector, see, that is one sector where they even have a district public health nursing offices, but in most of the states it is vacant. Of course, you can take in Tamil Nadu, we were for the past 25 years, there were a lot of posts were vacant for a district public health nursing officer post. So it is not only in this state, throughout the state, these posts are kept vacant. So the nurses are not given adequate promotion to represent themselves to the higher level bodies, and so that when there is a policy or a political involvement is there, we need to represent that such things are really not happening here. And one thing, a real ray of hope here in this present government of India, I'm really excited about Ayushman Bharat community health officer. Every sub-center, 5,000 population is being converted into health and wellness center, where I'm so delighted. Every BSc nurse has been appointed, or a diploma nurse with the 6 months course, she has been appointed as a community health officer. Almost many states have appointed through the webinars I came to understand from the government of India officials. So far, 11,400 nurses are working as a community health officers. So that is the biggest boon, because we had a testimonies from them recently, how they have changed the 1,500 household in that community, how the nurses are really making a big change. So they have already started the mantle of taking the leadership roles, and definitely these people is going to be representing to the government, because public health is the biggest backbone of our country. So that is strengthened, means definitely we are going to be strengthening our nursing, so that we will be representing at policy making level. But these are all, I'm just thinking it will happen in future, or it is happening at the moment. The third pillar, when you come to association, we can think of a national association and state association. We have a big association, Trained Nurses Association of India, and state level, we have a state branches, state association. There are a lot more associations out there, but to any profession to survive in the policy making, the association should play a big role with the political lobbying. So that it has to keenly to start from the local, the district level and the state level and the national level and coming to the international level. I'm so excited when ICN has joined with the Nursing Now campaign and did all these things. See, they have about 193 nursing associations joined there, whereas my own national association, TNA, still not a member of the ICN. So that is the pathetic thing. So we need to really advocate our nurses representatives so that we will have a stronger associations to represent our voice. So that here I would like to give a comparison. When in India there is a great lobbying always happens with the Indian Medical Association. So in such a way that nurses, imagine we have around approximately 18 lakh nurses. I always think in this connection, 18 lakh nurses mean in average on a family 5 votes in each family. Imagine my vote bank. So that is how we need to advocate with the politicians to make our representation. So other factors simply like a gender, I think somebody is going to talk about it. So I have given a little bit limited promotional avenues in the people who are working at the lower level, in the staff nurses level. They retire as staff nurses. They don't get much of a promotion. Maybe in a private sector, 1 or 2 there are things happening, but it's mostly in the government sector. They really retire as a staff nurses. So there is lack of motivation, lack of respect, in country like India, it's a patriarchal country. So mostly in all the profession like the doctors, pharmacists and other people, they are holding the highest position in the thing. So where here feminine dominated profession, we are overrepresented by the female population. So our wages also is been varying. I think WHO in 2019 report, it gives clear cut. The women are paid 28% lesser than the male. So this is the thing, see in country like this, they respect and give a recognition the pay package what we are carrying for. So that is also very, very important. So we need to have a good career avenue we need to have, and also we need to have a good motivation and a career pathway. So we need to create good, sorry, next slide. Okay. I just want to finish off with 2 slides. The one is structural factor, what we are lacking, and the functional factor, what we are lacking. The structural factor, low levels of nursing representation at the national and state level. We need to modify to represent ourselves as a policymakers in this country. And strongly advocating representational body for the profession on nursing issues or less, or they are there but not that much strong. And lack of clarity around authority and accountability for decision making. Though they say that she's a head nurse, but they have given the authority, they are not given accountability. They have not given any power to the post. So that need to be done. Then lack of role clarity between the state and national level institution, as health is a state subject. So that need to be done. And functional factors, when you think of functional factors, nurses are not appropriately prepared for the leadership or managerial position in this country. The eligibility criteria restrict the nurses from applying for leadership positions. Maybe 1 or 2 exemptions are there, but I'm talking on the general. And lack of transparency in decision-making process. And also, this is the main thing I really would like to address, lack of role clarity for each licensure cadre. This we need to address strongly, because in our country, even I finish a MSc nursing, I do the same job. Even a A&M does this. No overlapping is happening. When we are making the things, the licensure, but sorry to really tell, our council is the 1926 established council, which is a 94-year-old council, where the rule amendment has not been done for one of the rule is section is to monitor the training and practice of nurses. You know, in 1935 it was done. Imagine 1935, pre-independent era, and now we are in the 21st century. We need to do a lot of things to monitor the training and practice par with international standards. And actually our council have done that work, and I'm waiting for the approval from the government to each cadre of license, what is the roles and responsibility and accountability. And before I conclude, I would like to say about few words about my LEAP program, that is Leadership Excellence and Professionalism program. This is the one we have actually, fortunately in 2019 itself, I felt there is a vacuum of preparing second level leaders at the educational sector. So what we did is we prepared the vice principals and professors onto the LEAP training as a leadership training. So we had a bunch of 200 nurse educators as a leadership trainers in our hand. When Nightingale Challenge was declared, it was so easy for us to sweep through in the swing. Like we call them, and we are tailor-made in a different level to reach to that below 35-year age group, to the bottom level, grassroots level public health nurse and the clinical nurse to reach it. We made, you could see here my agenda is given. People think it is one-day didactic program. It is not at all a didactic program. We would like to tell you it is more of a participatory role play, giving a scenario, simulation based. That is what we did. And I would like to really, I don't have a time, so I'm not sharing some of my emails, what people have shared. Madam, we have come to understand we are already leaders at the bedside level for patients, for decision making, to call, whether to call a doctor or what to do. And you have really kindled the spirit that I have got a leadership role. Then only thing I have to present assertively. So that was so much feedback we got from many nurses. That was so, some of the, we were conducting in every district, 10 institutions we were conducting. People were calling me, Madam, why don't you give an opportunity for our institution so that we will call from small clinics and small medium level hospital nurses to participate, so that we will develop such things. So this was the amazing feedback we got it. I really have to thank my LEAP team for this. It is a teamwork. We had an expert LEAP team, and you can see here the statistics I have given. So far we have trained 1,323 nurses, and we are actually, due to COVID, we are not able to roll out the program, but I'm delighted that they have extended up to 2021 June, this year of the nurse midwife. Definitely I will be rolling out on this. And apart from that, also, if we need, I think a leader cannot be just like that, born in a 1 day or 6 months or in a training. If you need to just kindle the spirit and that insight you should give, I think definitely this program has done. And I'm sure with this, my bedside nurses definitely are going to move to the boardroom in the next decade. I'm sure my bedside decision maker will become a boardroom leader. Thank you so much.
Absolutely brilliant, Dr. Annie. And as I said at the beginning, you're a true inspiration in so many ways. And it's only through strong senior nurse leaders like you that we can empower our young nurse leaders. And you're really, so many steps ahead of the game, really. Looking at this program that you started in 2019, it's so relevant, isn't it, to today? Especially the focus on well-being and welfare for our workforce, because we do know that COVID has affected our nurses and the wider health workforce in so many ways. I think we all realise we have to look after each other as well. So thank you so much. I do just want to flag to colleagues and people on the webinar, I have put a few questions of thought into the webinar, and a couple of things I just would like to flag here and now is we are at Nursing Now with the Nightingale Challenge. We are preparing. Catherine Irwin and Hannah Finch are leading this work around a mass lobby to parliaments and governments, and we'll be creating lots of toolkits and information to help young nurses and more senior nurses to learn and find ways to really get their voice heard at those really important, whether it's the Ministry of Health or your parliaments, to really make sure that they start to understand what it is nurses do and the power that they bring